I'm Dr. Chaithra. I've done my MBBS from Rajarajeshwari Medical College Bangalore and my postgraduation in MS OBG from Kasturba Medical College Manipal, Udupi. After that, I did 1 year SRship in Hassan Institute of Medical Science, Hassan. It's a government college. Later, I wanted to do a fellowship, specialize in some branch, so I had interest in infertility, mainly because we had exposure to such patients and wide variety of cases when my post-graduation course. So I pursued that. Then I did my fellowship in reproductive medicine from Ishwarya Fertility Center, Chennai, 1 year fellowship. Then later I started my infertility practice. Right now I am associated with Shishu Fertility Center, which is located in Rajajinagar. Here, what is my personal success rates in that, globally it is 50%. I think all of us doctors also can give maybe plus or minus 5% depending on the patient factor. Right now what we are seeing is, we are seeing more difficult cases compared to what we were seeing at least 5 years back. It was a little easy to treat and the egg reserve at least used to be good, sperm counts used to be good. Right now all the cases, even though they are young, some patients have very poor egg reserve, very bad semen count, without any comorbidities, without any habits, smoking or alcohol, anything. Success rate depends on that individual couple. What is the thing? If it is a donor cycle, then we are going to take the eggs or sperm from the donors. The quality will be good, the age will be good, the success rates will be better. If we have done treatment for a tubal factor, suppose she's secondary infertility or the child has passed away because of some other reason, tubes are blocked, whether it is an operative surgery or maybe due to some infection the tube would have got blocked. In that cases, if the husband's parameters are fine, wife parameters are fine, egg reserve is good, then the success chances, yes, may not be in first time or second time, the possibilities are really good. In cases where the egg quality is poor or if the semen quality is poor, how much ever we try to do, we cannot change the quality of the embryo because it is from the couple, 50% is from the wife, 50% is from the husband. If that quality is compromised, how much ever effort we put is not going to help. What we can do is, we can give the best medicines possible, we can grow their eggs, we can give the treatment. But everything depends on the individual factor for the infertility. So what's my take home message for you guys is, you try naturally for 2 to 3 years. In case you are young, before 30 years, you are not able to conceive, meet your fertility expert, get yourself checked, what is the problem, couple investigation, both wife and husband, how the semen parameters are, how the egg reserve is. Just don't assume that you have irregular cycles, I may be PCOD. No, you may have less reserve. Semen analysis, you are able to ejaculate, you have the semen sample, that doesn't mean there are sperms in that. You have to get evaluated by your fertility consultant. See what the problem is. Don't just be ignorant, don't avoid going to the doctors. Seek treatment. You don't like it in some consultant, or take a second opinion, third opinion. All 3 or 4 doctors cannot be wrong about your treatment. So then decide, make up your mind what the treatment has been suggested for you and go for it. Because we are seeing now very old couple coming for treatment for IVF. So it is hard for us to make them pregnant, and that is not the age also. When we are young, have a kid, take care of them. Or if you have decided that no matter, I don't want kid, okay, stay like that for long time. Because I've seen many people regret reaching 40, 45, then they will feel, okay, now I want kid, at that time I made a wrong decision. Don't make such wrong choices.